Well, natural sunlight has been found to have many different health benefits, and recently artificial light, depending on the light wave and the color as well as the strength of the light, has been found to have benefits as well.
That's right. Recent studies have shown that light can be an effective tool to treat infections, muscular pain, as well as blood circulation. So I could use some sunlight right now. And so we're going to take a look at some what kind of treatments light can be used for. So take a look.
It's not only natural light that is used for treatment options. Artificial light is also being used for light therapy in ear, nose, and throat treatments, or for newborns with jaundice and other illnesses. Of those treatments, there's also therapy using various colors of visible light to provide people with emotional, psychological, and physiological comfort. One of the most common fields of treatment using light is in skin diseases. LED lights can help with treatment for wounds, offer anti-inflammatory effects, and have a healthy impact on skin cells.
The LED lights at the 415 nanometer length range are blue, and they deter germs and relieve acne, while the 630 nanometer length, which is red, induces the synthesis of collagen and has the effect of whitening and increasing resilience. The 830 nanometer length assists in treating wounds and relieving infections.
Light therapy is also being considered for treatment of more severe diseases. A team of Korean scientists recently announced that there is much potential for treating diabetes using light therapy, and it is drawing a lot of attention. By transplanting hydrogel that carries insulin-secreting cells into a mouse and exposing it to light, researchers were able to bring blood sugar levels to normal through a reaction between light and the cells. Usually, light is unable to penetrate the body due to muscles, bones, and fat, but in this case, the transplant hydrogel not only passes on the light, it also delivers the required drugs. And with this, there's more hope that this procedure can in the future offer treatment options for patients with diabetes.
The potential to treat diabetes with light therapy, it sounds absolutely revolutionary. And to talk more about this, joining us is Professor Han Se-kwang from Pohang University of Science and Technology, who is on the research team. Good morning.
Good morning, everyone. It's my great pleasure to be here. Before starting, I would like to mention my collaborator, Professor Andy Yoon, at the Wellman Center for Photomedicine of Harvard Medical School. We have worked together to develop this technology for about 3 years, which was online published in Nature Photonics.
Sounds like a groundbreaking breakthrough that you've made. And tell us about how this differs from conventional diabetes treatments.
Diabetic patients generally inject insulin before having a meal. Using this technology, they do not need frequent injections, but simple light irradiation. Optogenetic cells in the hydrogel can be triggered to release insulin for the treatment of diabetes.
Okay, so it's not just using light, but also you mentioned hydrogels. What exactly are hydrogels?
We use the hydrogels for the first time as light guiding materials. Hydrogels are cross-linked networks of water-soluble polymer and used to encapsulate drugs and therapeutic cells.
So those hydrogels could be implanted in the body and then irradiation, and that will cause insulin to be excreted. It is according to, I mean, it is a groundbreaking alternative treatment for diabetes. So what other steps ahead do you have for your finding to be materialized?
We will carry out optimization of this technology for easy applications using light-sensitive materials. After that, we will carry out preclinical and clinical tests in collaboration with global pharmaceutical companies.
So, and what kind of fields are you also exploring, and what kind of, I guess, what are some of the requirements for you to be able to materialize your
Putting this out of the market for treatment available to people.
A variety of photomedicines are being investigated for the treatment of cancer, stroke, and cardiac ischemia. For example, a photothermal ablation therapy using nanomaterials is being investigated for the treatment of cancer. In order for successful development of photomedicines, we need well-organized, cooperative, and multidisciplinary research, including material science, life science, medical science, and engineering.
Okay, well, this is a tremendous discovery. You know, I've known people who've been suffering from diabetes all their lives, and it is a very detrimental condition. Now, but you found this, and we're trying to get this out there into the open market there. But what other research will you be looking into following this breakthrough?
We have also developed a diagnostic method using optogenetic cells. Taken together, we will develop a theranostic system which can be used for simultaneous diagnosis and therapy.
Okay, so we're talking about diagnosis with light using this technology and also therapy at the same time.
Yes, that's correct.
I mean, think about it. I mean, I have a relative who has been suffering from diabetes and having to inject insulin every time, 3 times a day.
We're talking about millions of people with
exactly.
diabetes, diabetic patients. So good news to them. Thank you for your discovery and good luck with that.
Thank
you
you
very much.